Does that red light come on there?
The red and the blue. Yes, and reds.
No, on the screen. So there's various consensus of opinion as to why you work on the right foot first. I was taught you work on the right foot because the intestines are basically, the large intestine starts on this foot, goes up and across, and then it finishes on the other foot. So you want that to go in the right direction, so you're not sending poo the wrong way. So that was why I was told, sort of on it as a physical thing. Some people say that it's to do with the left and right side of the brain. I never can remember which way round it is, but one is the physical, one is the emotional. You do one or other first, whichever. This is your past foot, this is your present, so you do your past first. So, so there's lots of reasons why people think you do it. But every reflexologist I've ever met has always done right foot first. That just seems... I don't know if Ruth Hull in her book says anything about it. So if you're using cream, just put a bit on, and you just use Reflexology type needles that you would use in massage. What you're doing is putting the cream on basically, and you're getting that person used to your touch. And if they're a bit nervous, it just helps to. It's a bit more grounding, I suppose. And we always do the warm up prior to the treatment. And so that's why I would use cream just for that. So thinking about the 5 zones, the first thing I do is to work up the 5 zones. So alternate thumbs. And you work from the heel up to the toes. You do that 2 or 3 times. So you're opening up the zones. Then the other way, you go across the zones. Then you're going to rotate the toes, because the bottom of your toes corresponds to your neck. It's quite nice to loosen up the neck. And if you do that, you rotate the whole foot plus the knee and the hip. You hold on the pad underneath the toes and rotate. You only rotate the toes. So you rotate the toes and give them a little pull. And you rotate the ankle in both directions. And you push, which is dorsiflexion, so this is the dorsum of your foot. And you pull, which is plantar flexion, because this is the plantar aspect of your foot. So push and pull. And again, you're supporting the ankle while you do that. Then we're going to work in this area, which all of here is your lung area, shoulders here, but lungs in here, so quite an emotional area it can be. So you're going to push and do little circles around. So literally I'm pushing with my left hand and I'm pushing with my right hand, and your foot just has to be in the middle. So it's little rotations, and then you're pushing down. Then we're going to open the top of the chest, because this is like your lung area, and then the top here would correspond to your ribs and your breast and chest area here. So thumbs underneath, and they don't do anything. It's your fingers that are pulling out. So you're opening the chest up. It's called opening up the chest. Then you bring your hands round and you do a wave-like movement. We call this the dolphin. It's like a dolphin's tail. Down here corresponds to your spine, and this move is called a spinal twist. And it's like wringing out a dishcloth, but you can only really go down so far, although the spine goes right down to the bottom. You can only go so far because you can't physically go any further with your hands like that. And it's just like wringing a dishcloth like that. So you're not sliding, you're gripping and you're moving the bones. So you're helping to mobilise the spine. You can do it on the other side as well. This is your outside bony ditch, your shoulder and knee and hip. Then we're going to work on the pelvis down here, try and loosen up the pelvis. So the pelvis is in the bone of the heel here, the calcaneum. We're going to use the heel of our hand on the heel of the foot, and then you rotate like that. It's called a pelvic shuffle. We're also going to sandwich the toes together and rub. And coming back round, we're going to go into, this here is the solar plexus. It's a big bundle of nerves in the middle of the chest. It's closely connected to our abdominal organs, so digestion. And it's a big area for relaxation. If we pop our thumbs into that area in the middle and then you sweep out, remember I talked about the lines going across, well this is your diaphragm line, so it's underneath the pad of the foot. So this is a diaphragm sweep. And then you do the same on the other foot. Some people like to do the warm up and then the treatment on that foot, and then do the other foot warm up and treatment. Some people do the warm up on both feet first. It doesn't matter what you do. You can also do the treatment on alternate feet. Again, some people like to do that. I tend to do one foot first because then it keeps one foot covered all the time as opposed to keep taking the towel off. But you know, some reflexologists will do that, and I was actually taught to do it that way, but I do find it's a bit bitty. So I won't do the warm up on the other foot, we'll go straight into doing treatment. You start at the top of the foot and you work down. You do the pelvis here, the sides, and then the top. It's a logical sequence. It doesn't matter what order you do it in, but the exam says a logical sequence. So what's logical to you might not be logical to me, but nevertheless, if you start at the top, it's rather than doing a bit up here, then going down here, then a bit back up here, and a bit over here. It's a bit bitty, it looks a bit haphazard. So that's why we do it in a sequence, and that's why I give you a sequence to work on. But I will do it slightly differently every time I do it, probably. You know, mostly the same, but maybe slightly different order. The warm-up also doesn't matter what order you do it in, and you don't have to do all of those warm-up techniques, and in the book there's actually more techniques that you can do, but you just need to do a few. There might be some of those that you don't like, so leave them out. You know, you don't have to do them all. So pressure techniques, and that's what we're doing now. We're not really doing massaging moves, we're doing pressure techniques. The main technique you use is thumb walking, and you can try this on your own hand or your leg. You're using this part of your thumb, the proximal joint of your thumb upwards, so the last joint. So you're not moving this part of your thumb, you're only moving that last joint, and you're using it like a caterpillar move. So you press in, release, move forward slightly, press in, release, move forward slightly, and you go along like that. So you're sort of using the side, but you can also use the thumb straight on like that. And that's called thumb walking, caterpillaring, same thing. We also use our fingers with the same movement. So again, you're using the top of your finger. You can use 2 or 3 fingers at the same time, but that's finger walking. So they're your main classic moves that you will use. People find it really difficult. We're not used to using our thumbs. So first I would do is do the big toe. So the big toe, this corresponds with our head. So in here we've got our brain, which is on the top of the toe here. So do some circles on the brain with your thumb, or you can use your knuckle. Knuckles are good, it gives your thumb a break. And then I would work up both sides. Ooh, crunchy neck.
Yeah, it is really bad at the moment.
Right up both sides. And then across the front I would use fingers. So the front of your toe would correspond to your face, your jaw, your throat, all of that area. Teeth. Nose, that would be in there. So all of the stuff that's on the front here, really. Your eyes are actually somewhere else. Round the neck of the toe is your neck. So all around there. This bit here, right here, and it's not labelled on your charts, I do apologise. It's shown on your charts but not labelled. It's the occiput, it's the very back of your head where your neck muscles attach to the base of your spine. That's that point in there. But the whole of the neck round here and round the front, so that's the front of your neck there, back of your neck round here. Up the sides of all the toes is also your neck and sinuses areas. Here would be your thyroid, which is in the centre of your neck here. Big area there for your metabolism. When you're working on these bony outside bits, the side of your knuckle is a really good thing to use. You can work in there, gets in there really well. You can put your thumb in there to grip round, and it's quite a firm move, isn't it? But it's really good for those bony bits. You can work round like that. Then inside your head, you've got your pituitary gland, your pineal gland, endocrine glands that produce hormones, big important areas, especially the pituitary, the hypothalamus as well. So that they're right in the centre of your body here, the centre of your head here. So they're right on this outside edge, your hypothalamus there, pituitary and pineal. And I think the pituitary comes in as well, more into the middle of your toe. A lot of charts is one of the things that you'll find in a slightly different place. Some people just have it on the outside edge, some will have it right in the middle. So I've done it sort of stretching across both bits. The other toes, your toes are quite long actually, Suzanne, but you know, if you've got little toes, quite hard to thumb walk up them. So normally on toes, I would say, use your fingers at the front and then use your thumbs to go up the back and both sides like that. And the front, you can do the opposite. So use your fingers and use your thumbs as brace. We always use one hand as a support and one hand to do, but obviously here we can use both hands because we're supporting at the same time. So do the front, back, sides. So the front, face, teeth, jaw, sides is your neck, back's the neck. And the tops of the toes is sinuses, I think also as well, down the sides is also sinuses, so sinuses and neck. So you can go back and do the tops of the toes there. So I'm just doing little circles with my thumb there. And the top of the big toe is your brain, but the other ones it's all your sinuses. Then underneath your toes here, immediately underneath, this corresponds to this muscle here, the trapezius. So it's the muscle that is the big muscle in your back that comes to your neck here, to the occiput there, and then goes down out to your shoulder and then goes down onto your thoracic spine as well. And it's that muscle that gets really tense, doesn't it? And that's here, it's right along underneath the toes there. So you can give that a good old work. In between these two toes, 2 and 3, right in the web, that is your eye point. Bizarrely, I don't know why eyes are in a bizarre place when they should be over here. But most charts you find, they do have the eye point here.
That's why they say it's in the back of you. You've got eyes in the back
yeah,
of you.
Yeah, maybe it is, yeah. So that's your eye point. The next 2 toes is your ear point. And then the last 2 toes is your balance point. Then back to these 2, the web in between, if you squeeze that, it corresponds to your eustachian tube that joins your nose and your ear. You know when you get a cold and you're all blocked, sometimes you can rub this and it actually will go pop. It's lovely. So that's that bit in there. Then your shoulder is this pad here underneath your little toe here. So it's always like a big pad on everybody. So the back here will correspond to the back of your shoulder. The side would be the side of your shoulder, and the front would be the front of your shoulder here. So you need to work all the way around. So again, I'm using my knuckle. So the front, the side, and then the back. It's difficult to use your knuckle, so you can use your thumb again there. It's nearly always a tender area or crunchy area or hard area, because most people have got tense shoulders. Then this area here is the lung area. So lung area is zones 2, 3 and 4 in the whole of this area down to the diaphragm line and below the shoulder line. So we're going to work this area here. So again, in thumb walk, and we always move forwards with thumb walk. So you could do it with the other hand, and you could go downwards, but my thumb's still going forwards, if that makes sense. And you can do any direction, it doesn't matter. Across here is your bronchial tube, so your trachea and your bronchial tubes, so from your neck down to your lungs. So that's the tube there. So you can work down that. And then underneath here on the bunion joint, as I call it, that's your heart. And some of your heart's on this side, some's on the other side. So again, you can work in that area there, work on the heart. Then underneath the pad, there's in this sort of a semicircle going around. It's very distinct on most people, that pad. You very rarely can't sort of find it. That area is a chronic thyroid area. So your thyroid gland is up here, because it's in the centre of your neck here. But this is like they call it the thyroid helper. And it's there to support the thyroid. You often find ladies over 40, this will be quite crunchy, because their thyroid's not working as efficiently. And so this starts to get crunchy. You're all right, yours isn't crunchy.
Thanks.
You're too young. So give that a good old work. And then we finish by doing that diaphragm sweep like we did in the warm-up. So we've done the shoulder line and above, we've done the diaphragm line and above. Now we're going to move down into the abdominal area. So from the diaphragm down to the pelvic line will be the abdominal area. The waistline is halfway down there roughly. If you feel down the outside of the foot here, where the fifth metatarsal is, there's a bone that sticks out. It's not very pronounced on you. Sometimes you can see it, other times you can feel it, sometimes you can't. That's a good indication of where the waistline will be. But it will be halfway roughly. But you know, if you look at somebody's body, sometimes they're high-waisted or low-waisted, aren't they? And that could be the same on the feet. But roughly you can work out where you think it is. So you can stick your thumb there if you want to, and you know you're working above, or not, it doesn't matter. So I'm going to work the liver, which is all of these zones. It's right the way across, it's the biggest organ in the body. So you're going to work across the liver here. Again, you can go any direction. Underneath toe 4, you'll find the gallbladder, and the gallbladder sits right underneath the liver. It's where bile is stored, so when we have fat in our diet, the bile is released to emulsify the fat. So that can be quite a tender area. You can use your finger. If you want to make more pressure, you can press with the other hand onto it. You can use your knuckle. Again, knuckles are good, same as your fingers. But if more pressure, you would push down onto it. Over the other side, here, there's a little bit of pancreas in there. Most of the pancreas is on the other side. So you just give that a bit of a work, but you've probably already done it when you've done the liver anyway. Pancreas monitors our blood sugar levels. You all apparently eat too much sugar, so that's a good place to work. So we've done all of the bit above the waistline, except for in here we've got the kidney and the adrenal glands. Now the kidney lives underneath toe 2, so in zone 2, on the waistline. And it's, oh, I've got it covered up, it's a big yellow blob on the chart. So find the kidney and then just work on the kidney there. Then I would keep my other thumb, so the hand I'm supporting with, on the kidney point. And the adrenal sits on top of the kidney anatomically. So you'd expect the adrenal to be there. But sometimes, if somebody's got something that you think their adrenal should be a bit sensitive or a bit overworked or whatever, it's worth just having a little prod around above there and over slightly, because sometimes you can feel the reflex in a different place. So, you know, if somebody's very stressed, I would expect their adrenals to be a bit sensitive probably. If they've got inflammation or they've got some sort of allergy, I would expect their adrenals to be a little bit sensitive. If they're postmenopausal, I'd expect them to be sensitive because the adrenals are producing androgens to try and support the ovaries that have packed up. So all of those things, you might not feel anything, but you know, sometimes it's just worth going round in a sort of a bigger circle there to see if there's anything obvious. So then go back to the kidney and you work down to the bladder, and the bladder's down here in that sort of squidgy bit at the side here. So just work down the bladder there. Linda, could you move those front 2 charts off me just so you can see the charts while I'm doing? That's it, lovely. See, so I'm doing the kidney, that's that big yellow thing, and the ureter which goes down to the bladder. Then we're going to work below the waistline and above the pelvic line. So the pelvic line is where the bone is on the foot here. It's where you've got that pinker, darker skin there. That would be your pelvic line across there. And so above that is our intestines. All of that area is our small intestines. Small intestine you can do in any direction you like, because the small intestines, there's about 4 or 5 metres of small intestine, 4 and a bit. So it covers a huge area, so it doesn't matter what order you do it in, what direction. But when you come to do the large intestine, you really want to do it in the direction of flow. Especially if somebody's got constipation issues, you really want to be pushing it in the right direction. So you start down here, which is where the small intestine and the large intestine join. There's a valve there called the ileocecal valve. It's really good to give that a good work. It's an area of the body that regulates how much mucus we produce. And so people that have things like sinusitis, hay fever, asthma, you know, they've had a cold and they're all sort of bunged up and guitar-y afterwards, this area will help to balance that production of mucus in there. So it's a really good place to work. So once you've done there, you go up the first bit of the colon, the large intestine, which is the ascending colon, and then you go along the transverse colon, and the other half is on the other foot. So you can thumb walk up and then you can push up like that, thumb walk across, and then push across like that. So now we're going to work below the pelvic line, and all of this in here and up the sides, so where the calcaneum is, the bone, it corresponds to our pelvis, and the pelvis is enclosed in bone, isn't it, in your pelvic bones. So all of this in here will be your pelvic bones, muscles, ligaments, and then obviously underneath will be the other things. So work across the heel. You can use, like you did in the warm-up with your thumbs like that, that works well for the bones. Your sciatic nerve goes across here. It also goes up both sides of your legs as well. So again, anybody with lower back issues, it's a really good place to work across. And then up both sides of the heel. You can support with one and work up both the other side like that, or you can do both together, because you're actually supporting while you're doing both sides together. It's like a counter pressure. So whichever you find easier. So I'm just working over the bone here. round the ankles, so little circles around the ankles. This is our lymphatics, so it's your lower body lymphatics around the ankles. And often people get swollen ankles, don't they? That's because the lymphatic areas around there. Then you've got 2 points on the feet that correspond to your ovaries and your uterus. The uterus is on the inside because it's on the inside of your pelvis, and the ovaries is on the outside because it's outside of the uterus as such, although it's still inside your pelvis. So the uterus point is on the medial aspect of the foot, and it's halfway between your ankle bone and the point on the heel here. So it's between there and here. You draw a line, so you draw a diagonal line, and it's halfway. So we're looking at there. And there's quite often a dip in there. Not always, but quite often. So work on that area, but be gentle, because obviously, you know, if you're non-menopausal ladies, you'll still have periods, they can be quite sensitive. So then the same point on the outside, so between there and there, halfway, there and there, halfway, that's the ovaries point. So ovaries O, outside O, so over, outside, over ovaries. So that's your ovary point. Then your fallopian tubes run from your ovaries across to your uterus. I would try and get in the habit of doing them that direction, because if you're treating someone for infertility, you want to be pushing the egg the right way. So you want to go across that way. So again, I would use 2 or 3 fingers to go across there, because there's also here more lymphatics in here, groin lymphatics. And it's your groin area is in here as well. So going across the top like that. So just doing 2 or 3 times across the top. Then there's another important point around the front of the ankles, the ankle bone here, the malleolus. It's sort of front but slightly down. There's a little dip that you'll find. Usually you can feel that dip, and that corresponds to where our hip and our pelvis join. Hip and our spine join, not our pelvis. And it's called the sacroiliac joint. And it's a really important joint because it's where the pelvis, so the hip, the side back of your hip joins the bottom of your spine. So during childbirth, obviously your pelvis is expanded to accommodate the baby's head, so that both those joints on both sides get a lot of pressure on them, and also the weight of the baby. People who've got lower back pain, often sacroiliac joints are a big problem there, so that's a really good place to work. So we've done all of the sole of the foot, we've done the sides here, but we're going to now do a bit more of the sides. So here, the inside, the medial aspect, all the way down here is your spine. And the spine will be different on everybody because we've all got different spines, haven't we? You know, some people have got a kyphosis, some people have got a lordosis, might have a scoliosis where you've got a sideways bend, and that can be indicated in your feet. Some people have got a flat arch, and that can be spinal issues or digestive problems if the arch is flat. So you're going to follow the line of the bones down. So wherever the arch flows along, that will be your spine going down like that. So we do 1 row on the bone and 1 row underneath, just so you're getting all the nerves on both sides of the spine as well. So again, I would thumb walk down and then do the other row down there. Then I go across, because then you make sure you catch all of the nerves, because all your spinal nerves come out from your vertebrae, so from your spinal cord, which is inside the bones. So it's good to work all the way across there. Do some little circles as well. And tapping. It comes from Thai foot massage. It's quite stimulating, so you're stimulating all the nerve endings, all the nerves that come out from the spine. So then when we've done the spine, you could do your spinal twist again here if you wanted to, like you did in your warm-up. Then we're going to look at the outside edge of the foot here. So the outside edge, we've got the shoulder, which we've already done, but we'll do again. Then you've got the knee, so that's where that waistline mark was there, the fifth metatarsal. And then the hip is further down. And then I would think that the leg would be up here. It will be in that bit if you're looking at the leg in the fetal position. But that varies on charts, depending where you think the leg is really. So you're going to work both of those areas. So I would use that edge of your knuckle all the way down there. So you can go right the way down. You can go back up. So right the way down here. Back up. Then we're just left with in between the toes, we've got those are your chest lymphatic nerves. So the chest lymphatic, so drain, all the lymphatic and drain out of the chest and empty into circulation under the pancreas into the subclavian veins. So you want to drain into those areas. But also in between those bones, because the bones correspond to your ribs, and in between your ribs you've got muscles, intercostal muscles. So that must correspond to those muscles too. So what I would do is work downwards in between the bones, because then you're opening up the lymphatics and also working on the muscles. But then you want to pull and drain the lymph up into those ducts and to the subclavian veins there. Then you're going to work across the top of the foot, because this is our ribs, as I say here. So ribs and breast area on the top of your chest here. Your breastbone is underneath your big toe here. So you make sure you catch that in. And then you carry on down the foot, because this part of your foot here, the arch bit at the top here, that I think corresponds to your back and abdominal muscles, so it's your core area in here. And again, you'll see that as different things on the charts. People have different ideas of what they think that is. So right the way across there. So then you've done everything. You've done the bottom, you've done the sides, you've done the pelvic bit, you've done your top here. You can squeeze your calves. You can do this at any time. I sometimes do it after I've done the pelvis. So going up the calf here. They say that the calf is a chronic digestive area. It's also a very emotional area. People hold a lot of tension in the calves. So you literally just squeeze. You go up to the knee, you can reach, and squeeze down like that. And squeeze the Achilles. Someone who was pregnant, openly much not ready to deliver, be very careful when you're working up with the avoid the calf, because there's an active village so it's between 6, 4 fingers up from 4 of their fingers up from the but it's also a really good point to work on for people that have menstrual problems, so period pains, EMT, that point's really good to work, but don't work on it pregnancy. It's 4 fingers up from the ankle, 4 of their fingers, so if they've got tiny fingers it'll be less than, and it's a point, so it's just in on where the tibia goes, that bone, there's a sort of soft bit in there, and you can often find it, people go, oh blimey, that's tender. Yes, but it's just one to be aware of when they're pregnant. Unless it's living and glad he's working out. So that's all of that foot done. I would always just finish off doing a couple of the warm-up exercises again, just to sort of loosen up the foot again. Then you would do exactly the same on the other foot. And as I say, everything down to here is the same. So you work toes, so you do the exercises, all of the toes, the neck, the long trapezius, shoulder, lungs, heart, bronchial tubes. The only difference on this foot, on the left foot, you have your tube that goes from your throat to your stomach. So that's on this foot as well, which is not the same. Exactly lurking around the heart. So that's the only difference here you've got. It's only when you get to the diaphragm line, do the diaphragm sweep, then we're different. Because above the waistline, you've got your stomach, and you've got your pancreas in here. And here, so underneath these two toes here, you've got the spleen. The spleen's a really important area for your immune system. It makes white blood cells fight infection. It also destroys red blood cells and also stores blood. Maybe lymphatic tissue, not all of it, but a lot of it. It's a really important area for the immune system, so give that a work. And then, below the waistline, you've got your small intestines exactly the same, but then you've got your large intestines, so you've got the rest of the transverse colon, so you're going up the ascending, across the transverse, the other bit of your transverse, and then down the descending, and then across here and up to the rectum. The rectum's in the same place as the bladder over here. So across, down, and then along. And again you can do your pressure thing. Then you're down to your pelvis again. The kidneys, adrenals exactly the same as on the other side. Pelvis is exactly the same. You do across here, sciatic nerve, sides, uterus, ovaries, fallopian tubes. You do your round your ankles. Then you come and do your spine here. So spine's exactly the same. So all the way down the spine, underneath. Do a cross this way, do your little circles, do your tapping. Come over and do your shoulder, knee, hip. Then you do the top here, so your intercostal muscles and your lymphatics. Then bring your lymphatics up, work across the breast area, ribs, down into your abdominals and back muscles here. And then do what you did in your warm-up, a couple of things from that. And then right at the end, when you think you're finished, I would get them to take some deep breaths. And you put your thumbs on the solar plexus, so that dip right there in the middle of the foot. And you get them to breathe in, and you press in on the in-breath. And then you relax when they breathe out. So in on the in-breath, and you can do it with them. And so take a deep breath, in and out. And in and out. And you always feel a bit of a prat doing that, but it's a great way of waking them up if they've gone to sleep. So, and then you just cover their feet up and you're done.